qualified nurse who would want to come to Australia and practice as a registered nurse, well, you are in the right place, because in this channel we're going to talk about how to become an Australian nurse if you trained and practiced in a country that is different from Australia. My name is Faith. I was born and raised in Kenya. That is where I did my bachelor's of nursing and practiced for 1 year before moving to Australia. My journey to Australia was not an easy one because of lack of information. It was challenging since I had to depend on Google, I had to depend on YouTube for me to find the information. And I wish that everyone will find this information to make their pathway easier. Going forward, I'll be posting series of videos. I'm planning to post around 20 videos in the upcoming weeks. These videos will take you step by step into applying for your registration as an internationally qualified nurse to transitioning to become an Australian registered nurse. The first thing we will be talking about is what we call the self-check. In self-check is where you apply to AHPRA and they will categorize you into different pathway. There is something we call pathway A, there is pathway B, and there is pathway C. In pathway A, it means you have done a bachelor's of nursing in a country that matches the same standard as the Australian nursing. And so probably you don't need to really do the NCLEX and you don't need to do the OSCEs. You just have to submit certain documents and the number of your hours and you will find your registration. Such countries include the UK, the US, the Canada, Ireland, and New Zealand. There is pathway B, which I was among them. In pathway B, it means you have done a bachelor's of nursing in your country, but it doesn't really meet the standards of bachelor's of nursing in Australia. And so you have to sit for exams, which include the NCLEX and the OSCEs, and pass English proficiency test. It could be the PT, it could be the IELTS, it could be the EOT, and then apply for the registration after you passed all the 3 exams. In pathway C, it means you have done a training in your country, a nursing training, but you really need to do further studies, like you have to apply for an Australian education provider for you to do further studies in nursing to be able to apply for registration. And so in this YouTube, we will be focusing more on pathway B, which most of the people fall into. Countries like the African countries, the Asian countries, South American countries, and the Middle East countries. This is where majority of us will fall into. And the second thing we will be talking about is what we call portfolio. In portfolio, this is where you will submit your documents to AHPRA, and there is a way the documents have to be certified, and there is a way the documents have to be submitted for you to avoid delays in your process. And so we will talk about these documents, we will talk about how to certify the documents. And the third one, we will be talking about orientation 1 and orientation 2. This is pretty much online modules where you will have to study, and pretty much like any other module, you just have to study online and finish the modules for you to be able to practice in Australia as a registered nurse. It entails more of understanding the Australian healthcare system and the cultural practices in Australia, which I found it pretty easy. The fourth thing we'll be talking about is doing your NCLEX, studying for the NCLEX and sitting for the exams and passing the exam. In this case, the NCLEX you will be doing for Australia is pretty much the same as the NCLEX you do for Canada, NCLEX you do for the US. And so that means you can study for the NCLEX anywhere across the world and sit for the exam in any NCLEX exam center across the world. That makes work easier for you as you try to do your NCLEX. And then we will be talking about the OSCEs. This is another exam, but this is the practical exam, which requires you to move to Australia and sit for the exam. This is totally different from the NCLEX because you have to be in Australia to sit for the exam. And there are 2 exam centers in Australia for the OSCEs. One of them is in Melbourne and the other one is in Adelaide. It's upon your choice. When AHPRA sends you an email, it's either you accept or you decline until you find your favorite place of exam. But honestly, I will tell you, any exam centers are the same. You just have to know what you need to do for you to pass the OSCEs. We will also talk about the visa options, because for you to come here and do your OSCEs, you will need a visa. We will talk about the visa options when you are applying to come and do your OSCEs exam. We will also talk about the visa options after you have received your registration and you need to come to Australia and practice as a registered nurse in Australia. That will come under a different video. We will further talk about the job opportunities in Australia. We will talk about the aged care jobs, the hospital jobs, the community setting jobs. In that case, the community setting job could be in disability sector. We will discuss more about it, and we will try to dissect and understand the scope of practice. We will understand the difference in aged care sector, community sector, and in the hospital setting. We will further talk about the visas that you will need for you to practice. Majorly, most of the overseas qualified nurses will need an employer-sponsored visa. It could be an employer-sponsored visa 482 or 186 visa that will allow you to come to Australia and practice as a registered nurse. We will discuss that in details. We will also talk about your first job interview, where you will be applying for jobs and going for the interviews, because I came to realize that our settings in our countries are totally different from the Australian setting. Personally, I used to practice in a hospital. I had never seen an aged care in my country, and so coming to Australia and I have all this diversity where there is aged care jobs and you have to sit for the interviews in aged care. The setting in aged care is totally different from the setting in the hospital, and so we will be discussing these issues and help you try to really understand the difference and where you can apply for your first job. We will talk about the interview questions that you will be asked in the aged care setting, as well as the interview questions that you will be asked in the hospital setting or in the community setting, majorly in the disability sector. I really look forward into seeing you in the upcoming series of videos. And next week we will be talking about the self-check. Prepare yourself, subscribe onto my channel, click the notification button, but most of all, be ready to self-check yourself next week and know which category you fall into. Welcome and see you next week. Bye.